All right, good evening, everyone. My name is Dr. Sapphire Boone, and I am the owner of Advanced Social Work Solutions. Thank you for joining the study group tonight. Tonight is going to be a little bit different than our traditional study groups. Our traditional study groups, we do some lecture and then questions. But I want to be able to offer classes. I normally in every series have classes that are free for people to join, where we just kind of go over questions and practice. And so diagnosis and medication is one of those areas I think is a good topic to do that with. We'll still be able to discuss different definitions and concepts as we go through the questions. Um, but it's a good one to go through since diagnosis and medication is not a huge amount on the exam. Like the exam is not all diagnosis. It's really an area that you'll get some exposure to some of the things that are kind of foundational. And then also, diagnosis and medication is really heavily definition based. So you're going to see scenarios, but a lot of it is based upon those definitions and making sure that you know kind of what to look for in the disorders. I'm going to drop the presentation into the chat. You should have received the email, but I know sometimes those emails don't come through. But I'm going to drop it into the chat. This is going to be the presentation that we're going over tonight. If you received the email ahead of time, you were able to kind of see what some of those disorders and medications that you need to study, and hopefully you got a chance to study them for a little bit. So you kind of had to do a bit of pre-work, but even if you didn't, this content, if anybody has done any type of studying, then this is going to be a good kind of barometer for you to see, okay, do I need to study it some more? Or I think I'm good with diagnosis and medication. I know for my exam, I literally had the DSM-5 out and was studying it. And I did not have a lot on my exam. So, and even with the clinical exam, I feel like that's one of the things here a lot is that, it's clinical, so you think you're just diagnosing the whole time, but really it's still a whole bunch of other areas as well. So, but still important, still want to go over it because you'll see different types of questions and you'll see kind of the different types of questions that you may see on the exam. So I dropped the handout in the chat. I'm going to share it on my screen as well. A little bit about tonight. So tonight is a shorter class. We're probably going to end just a little bit earlier, only because I am in Atlanta. So shout out if anybody's in Atlanta.
Woohoo!
I'm woohoo! I'm in hot Atlanta, y'all. Really, it's been nice. It's been nice. Tell me put some suggestions in there, okay? What restaurants we need to go to?
Okay.
Um, yes, yes, please. So it's going to be a little shorter. So we're going to end right at 8:45. So we're going to jump straight into the questions. But we are going to go over a little bit about how to break down questions as well. I don't see a handout. Okay, let me put it one more time. I'm in New Jersey, yes. I'm actually from Baltimore, so I'm in New Jersey a lot. Jersey, Philly, those are like my regular stomping grounds that I go to. Okay. So wanted to, especially for those that this is your first night, welcome again. So the first slide just kind of goes over some free resources. And I just always want you to know that there are free resources. You don't have to pay a whole bunch of money, that there are things that you can do to kind of cut down on costs. And so I wanted to drop this here. I always kind of drop it here. Behavioral health app, Pocket Prep is also one of those things that's pretty good for especially trying to keep fresh with and study. It's a good app. Tonight we're going to do the liked method. So the liked method is just a way for us to process questions. We're going to read the last sentence first, identify the type of question. Now tonight is going to be diagnosis and medication. So that part is going to be super easy to identify. We're going to look at the key concepts. We're going to eliminate some answers and then hopefully be left with our right answer. So I always start out with hot topics. So hot topics, I always, in each module, I go over what do you need to know. And again, we know that the exam is Russian roulette. You don't know what you're going to get on your exam, but I want you to have some foundational things to definitely keep in mind. Some things to highlight that are kind of newer, I would say, are the sexual disorders. Don't forget about those. And sleep-wake disorders could also be on your exam. So all the other disorders I feel like are pretty common. But I feel like those two are things that, definitely weren't on my exam when I took them back in 2011. So something just to keep in mind. Also with your medications, you're gonna want to know the brand name and the generic, which is also, I feel like, something that's also been a little bit of a change. I think the use of medication has changed a little bit. And so now we should know the generic as well, because normally doctors will kind of start with the generic versus starting with that brand name. And don't forget your substance use terms and your substance use disorders. Don't forget those, okay? Sometimes it's easier to forget those, so I wanted to remind you to also understand some substance use terms. And if we don't get to all 22 questions tonight, then that'll be part of your homework. Diagnosis questions. You want to highlight all of the symptoms present in the question. Your onset, right? Age of onset. Sometimes that one is not as important, but the age of the client may be important because there are some disorders that are more common in children, and then some disorders that cannot be diagnosed in children, typically, right? And then the time frame is probably the most important, right? Time frame could typically make or break which disorder it actually fits in terms of the criteria. Some of the symptoms may overlap with several disorders. For example, irritability overlaps several disorders. So you want to know the main features of the disorder. So when you are studying and you see, for example, for depression, major depressive episode, you need 5 symptoms, right? But you have to have, like, if it says one of the 5 must be, and then it lists those symptoms, those are going to be definitely your main features. Or you just want to, like, in general, what symptoms kind of differentiate or make it different from other disorders. And so that's going to be really important. So we're going to find some examples as we go through. So for the master's exam, it's really going to be about symptom recognition. Whereas for the clinical exam, you want to go a little deeper. You want to know not only what the disorders are, but maybe what's the best treatment. Like if there are certain therapy approaches specific for certain diagnoses, that would be something that you would want to know. And also differential diagnosis, which is what I just talked about, that's listed in the DSM-5, where it will say, you have ruled out these other disorders before selecting this disorder. And again, on the clinical exam, you're going to be diagnosing, yes, but you're also going to be really focusing on intervention as well. So what are those symptoms? What is best? So for example, another example, like a clinical example would be schizophrenia, right? Journaling, like asking your clients who have schizophrenia to tell their story or to journal or to have some type of activity that increases self-awareness is probably not the best thing to do, right? Because they have a problem with reality, they have a problem with insight and awareness. So exercise like that would not be, that wouldn't match their disorder and kind of what they're going through. So something that also just to keep in mind that you're not only diagnosing for the clinical exam, but you also want to know how those diagnostic criteria impact how you will treat them as well. All right, let's get started. So I dropped a polling link in the chat. It is optional, but I do offer it because I want to be able to see what everyone is choosing. I'm going to drop it in the chat again. You can click that link, and then it's just one link for all the questions. It's going to show one question at a time. I'm going to give you a few seconds to look over the question. And then based upon the results, I can say, okay, 80% got it right. We'll go over the answer no matter what, but I probably don't need to spend more time in it. This class specifically, we probably won't spend a lot of time with rationale because it's pretty cut and dry. And if there are things that you need clarification on, please let me know so we can definitely dive deep. So go ahead and take a look at number one. It should also be up on the poll, and then we'll go over the answer. All right, so this one was pretty simple, just a one-liner. It's uh it says accept, right? So when it says accept, you want to think about it in the opposite way. So you're going to be eliminating the answers that are actually right. So all of the following are changes in the DSM-5TR except. I always get this question, is the DSM-5TR on the exam? So my answer would be, I'm not sure. They're a little bit unclear when they make updates. And so I heard, like, I want to say a couple of years ago, they said they were going to update the exam in 2024. Then I heard 2025. So I'm not sure if they're updating the exam and when those updates, they're not super transparent about content change and those types of things. The changes aren't so dramatic, right? So I would just really focus on, some of the highlights. I would still know the changes, but I wouldn't like stress out about it. So the answer to this is D. So the inclusion of a new diagnosis. So there is an inclusion of a new diagnosis called prolonged grief disorder. There is an additional of a symptom severity scale for anxiety disorders. And there's a change in terminology from gender identity disorder to gender dysphoria. So just wanting you to know these changes. And then also, I know it's a little bit jumbled at the bottom, but there's a video on the changes at the bottom. And then also there is a DSM-5TR quick study. It's like a laminated pamphlet that you can get from Amazon. That's like $7. It's good for practice and it's good for studying. So I'm not telling you don't DSM-5, but I feel like, yes, you should know the major criteria, but I feel like the quick study is pretty good in terms of what to know about different disorders. And it's good for on the go and things like that. So the answer is D. So what you'll see is that I'm visual, so I color code everything. So the teal is going to be your key concepts in the question. The teal is also going to be the answer. So the answer is D. You'll always see a rationale, right? The reclassification of autism spectrum disorder to include separate categories for Asperger's syndrome and pervasive developmental disorder. So that must not be a change. This change was already present in the DSM-5. Little trickery. It's not something that changed in the TR. It was already there, right? We already kind of looked at these different spectrum and different categories, separate categories. The yellow is going to be my distractor, and then the red is what I eliminated first. So we're going to be going over process of elimination, and a lot of those things are going to be based upon the criteria because we're going to be diagnosing. All right, let's go to the next question. So if you go to your poll and refresh it, you should see the next question on there. All right, let's see how we did on number 2. Pretty simple question. We did have a majority of it correct. Major depressive disorder. Major depressive disorder is characterized by persistent feelings of sadness, loss of interest in activities, and changes in appetite and sleep patterns. This is commonly prescribed for depression. And we know that because I see that the second kind of answer was A, anxiety. And so, what you want to know about anxiety when it comes to the SSRIs or the more traditional depression medication is that, yeah, depression medication can be used for anxiety because anxiety is fast acting and addictive. The traditional benzodiazepines and kind of the traditional anxiety medications. So you just want to keep that in mind. But I would go with what it is commonly prescribed for, unless it says in the question, like typically when it says something to where an SSRI is for anxiety, is if we want something for the long term. Like if we want to treat the anxiety long term, then it has to be a SSRI because we know that traditional anxiety medications are fast acting and addictive, and we wouldn't want someone to be on it for a long term period in general. Okay, we know that there are different circumstances and exceptions, but the exam doesn't deal typically with exceptions. It typically is going to deal with just an ideal, common, textbook, standardized kind of situation. Okay. Okay, let's go with 3. All right. So essentially, what this question is asking is when you have a stimulant with a client that has ADHD, what is the effect called? That's really what this question was asking. Um, and it's something that I have on my hot topics because it's something that is kind of newer that's coming up, is the paradoxical effect, right? So a stimulant seems like it would not calm someone down. Like if you do not have ADHD, a stimulant is going to make a person be very on edge, and be kind of what we traditionally think of when you hear the word stimulant, right? But with those that have ADHD, it actually has a paradoxical effect, meaning that it actually has a calming effect. And so that's why B, as in boy, is the answer. So again, this was just looking at what type of impact or effect does stimulants have on someone that has ADHD, and it's called a paradoxical effect because normally a stimulant speeds things up, but with someone that has ADHD, even though for everyone else it speeds things up, it has a calming effect, which is kind of the opposite of what it normally does. So just wanting to have a question about that. Any questions about this answer for number 3? Okay, go with 4. Can someone in the chat run down to me B, C, what are our time frames? A, B, C, what are our time frames?
Do you want me to talk?
You can talk it or you can put in the chat either way.
Um, from what I remember, and I don't want to cheat and look in my book, but from what I remember from me diagnosing clients, because I work for a private practice, GAD is like 6 months max, I believe. And the keyword that I always remember is like excessive worry or um like muscle tension. Those are symptoms, difficulty sleeping, restlessness, feeling keyed up. Um, so that's usually what I listen for when I'm diagnosing clients with GAD. And I believe the max is 6 months.
Perfect, perfect. What about, and I see in the chat we have Yolanda that said major depressive equals 2 weeks. Perfect. And then for panic disorder, it's going to be at least one panic attack that's followed by a month or more of one or both persistent concern or worry that there's going to be additional panic attack or some type of change in behavior to prevent another panic attack or related to the panic attack. Um, and so the answer is going to be C, generalized anxiety disorder. which I believe most people got it right, but wanted to show you how that time frame, yeah, most people definitely got it right. Wanted to show you how that time frame is definitely significant. And then just giving you some information about GAD. So you'll see some like sprinkles of some information as we go through. And with GAD, it's 3 or more of the following symptoms. And it's worry about everything. It's not necessarily worry about a specific thing, but multiple things. The person is like generally worried about these different things, right? Where we know there's other anxiety disorders that are more specific, where the anxiety is just for certain situations. All right, let's do 5. Okay, what's the difference between 1 and 2? And I used to say they're not going to ask you this on the exam, but then I had someone say, well, I did have a question about it. So I was like, okay. I don't think in terms of giving you a scenario, they could. I mean, they could have bipolar 1 and bipolar 2 both in the answers. Um, but when I talk about that, I typically mean like they're not going to make you decide if it's bipolar 1 or bipolar 2, but they might have a question about what's the difference, like what makes them different. And so this answer, which most people selected C, bipolar disorder involves at least one manic episode, while bipolar 2 involves at least one hypomanic and one depressive. And so by definition, bipolar 2 is, well, bipolar 1 is going to be more invasive because of that manic episode. All right, this one's a little longer, so take your time, read through the scenario, and then pick your likely diagnosis. Okay. So it seems like everyone eliminated C. So we don't think that is generalized anxiety disorder because we see things in here like hallucination. So we know that anxiety typically doesn't have, typically we're not talking about whether we're having hallucinations or not. Um, and really the denial of hallucination or delusion, and also saying that the client doesn't feel distressed, only productive and a bit impulsive, it's going to lead to hypomanic. So we still have our elevated mood. It has to be at least 4 consecutive days. Yeah. So we still have limited sleep. You see the limited sleep, you see the more energy, but the key here is that there's no hallucinations or delusions, so no psychotic symptoms, no distress to their overall functioning. Okay, let's look at the next one. Okay. So this is one of my newer questions. So here we go. Um, what I was trying to do is to show you the difference between manic episode and hypomanic episode. So we have over the past 10 days, he has barely slept, has spent 15,000 on unnecessary equipment, become increasingly irritable, recently fired for yelling at his supervisor, talks rapidly, um, and then insists receiving special messages through street signs, leading him to be hospitalized because of the manic episode. Now, I do understand that psychotic disorder also has different symptoms that kind of could also go with this. So with psychotic disorder, um, so psychotic disorder is really an umbrella. So when you think of psychotic disorders, you think of schizophrenia, schizoaffective disorder, delusional disorder. There's also a disorder called brief psychotic disorder. So that might be what you're thinking of. But just psychotic disorder is actually more of an umbrella. It's like a category of disorders, not necessarily a specific disorder. Brief psychotic disorder is 1 day to less than 1 month with a sudden onset and a full return to their functioning. So if we would have seen that sudden onset, full return to functioning, often triggered by stress, and if we saw the word brief in front of that, then okay, maybe that could be it. But we don't really have anything about him, this client returning back to their functioning. So that's why psychotic disorder sounds really good, because there are psychotic symptoms happening, like delusions and hallucinations and things like that. But I wanted you to know that psychotic disorders is an umbrella. Brief psychotic disorder is 1 day to less than 1 month, sudden onset, full return to functioning, often triggered by stress. Okay, go ahead. Is it I want to say Tracy, but that's probably not right. So tell me what your name is. Go ahead.
Tracy? Oh,
Tracy.
so
Yep, go
I
ahead.
was just thinking about um this I guess concept, we call it a conceptualization, I don't know. But I was thinking that for manic episodes, and I don't know if this is something that's right, so I'm gonna run it past you so that I can
Sure.
remember it if it's right. But that usually in manic episodes there's like an excessive spending of money.
Mhm.
Um
Yes. Mhm.
okay, so that's kind of what I like. The 15,000 stood out to me because I know usually when people have a manic episode they spend a lot of money. But is
Yes.
that something that I can explicitly say that is connected to a manic episode? Could it be a situation where someone spends a lot of money, but it's not a manic episode?
Yes, I would say it could be if it was isolated, but with the other symptoms that we're seeing, it's definitely manic.
Okay.
Um, I would say spending lots of money is a key feature of a manic episode that you see on the exam. Like the exam normally will say spends lots of money, talks rapidly, or has some type of high risk behavior that's happening. Also, the sleep. So you'll see lack of sleep, you'll see spends lots of money, and typically talking rapidly. Those are kind of the three ones that you'll see on the exam.
Hmm.
But you definitely want to know all of them because there are 7 of them. But those are kind of the like standout ones that you'll be like, oh, okay, this is definitely a manic episode.
Hmm.
Yeah.
Okay. And
And
usually with
then
the
if you, oh, go ahead.
oh, I was gonna say usually with the manic episode, you are hospitalized versus a
Yes,
hypomanic, they don't require hospitalization.
correct.
Okay.
Yes. Yep. Also with manic, you're going to see psychotic symptoms like hallucinations, delusions, or disorganized. If you don't have any psychotic symptom and there's no impact on functioning, then by definition, it can be a manic episode. So that's really the difference. Hypomanic is more of a functional thing. It's not distressing them. They can still keep a job. They still have their social functioning. So social and occupational functioning have not been impaired with hypomanic because it's less severe. Whereas a manic episode, you see disruptions, you see distress, in their functioning. You see hospitalizations. I'm not saying that the exam will always say that they've been hospitalized, but that's typically also one of those kind of key factors. Um, and typically it's going to be because of those psychotic symptoms has put them in the hospital, right? They're not able to manage with those psychotic symptoms. They're not able to like reset or calm down or, come out of it. They need that extra intervention to be able to get them to stabilize. The other thing I wanted to say is that you may also see this in conjunction with depression. So if you see these symptoms and depression, then you'll know it's bipolar, right? So it may ask you specifically about a manic episode, or you may see the symptoms of a manic episode with depression, and then you'll know the answer is bipolar. Does that make sense? So I wanted to make sure you got a question about hypomanic, a question about manic, and then knowing, kind of the ingredients that go into bipolar 1 and bipolar 2. So that's kind of what we have gone over so far. And then here are the slides to kind of reinforce those concepts. So when you go back over the questions and you're studying, you could kind of look at this. Could the spending thing be a feature of hypomania? Sure, right? With a hypomanic episode, you're going to have impulsivity, right? So they might be doing a lot of Amazon shopping, but it's not going to cause distress, right? It's not going to cause them to be in some type of extreme debt. Like you see how 15,000 is like a lot, right? It's very excessive. Whereas hypomania is more of, okay, I'm impulsive. I make decisions really quickly, but it's not going to impact me to the level of a manic episode. So yes, because remember with hypomania and mania, both of them have it's the same features. It's just different time frames and different severity. Yes. Yeah, they have the same exact 7 symptoms, right? What manic episode says is that they have psychotic symptoms, they have impaired functioning, social, occupational function, and that also necessitates hospitalization, right? So that's going to be kind of your differences there. So more severe. So absolutely could have similar behaviors, but the impact is going to be different, right? The severity level is going to be different. Hypomania, I just might stay up. I've stayed up for days, but I cleaned my house. I was productive at work. Like it's like almost seen as a good thing. Because it's not distressing, right? It's not stressing your life. Whereas manic episode, it needs intervention, right? You're not able to continue functioning properly in that state. Oh, I like it. Straw depicted brief psychotic disorder. Oh, I like that. I like that. I like that. I mean, that could be a good homework. Look at straw and see what you find. See what you find. Yeah. Yeah. Has to be hospitalized manic. Yeah. And she probably would have been hospitalized, definitely for sure. Hopefully that's what they did with her, after the scene ended. And this is just some slides that goes over everything we just talked about. Oh, I have a link to the DSM-5 TR for free if anyone would like it. I'm sure everyone would like that. Absolutely. Absolutely. Especially the new one. Yes, yes, absolutely. Okay, let's do 8. And then this will be our last question. Hold on, I'm putting it on the. Yeah, and if you send that to me, I can also. Oh, there it is. Okay, great. Thank you so much, Dr. Antoinette. That's perfect. Okay, yes, yes, yes. Adjustment disorder. Perfect, perfect. And we can go over this a little bit. So with adjustment disorder, which is C, adjustment disorder, it's characterized by development of emotional behavioral symptoms in response to identifiable stressor. So we need a stressor. Let's look at why it's not the other option. So it's not a depressive disorder, because this would be considered if the symptoms were more severe, pervasive, and met specific criteria, including the presence of depressive episode, but we don't see that. We don't see kind of depressive symptoms. It's not generalized anxiety disorder because that's characterized by excessive anxiety and has to be occurring more than not for at least 6 months. So we don't have that. We don't have 6 months. And it can't be persistent depressive disorder because that has to be for at least 2 years. So this is why I said time frame is definitely key. Um, Time frame is definitely key because we see symptoms have been present for the past 2 months. And then we also want to look at just actual symptoms. So I'm not saying just only look at the time frame. You want to also look at the actual symptoms and you want to consider all symptoms as well. So how are we feeling? I know it was just a few questions. I may do another live maybe before our next class next week, just going over the rest of the questions, but you have more questions. So you have 9, starts on, don't look, starts on page 31, and then it goes up to question 22. So that's going to be your homework. I'm going to put it in the chat just one more time. And I'm also going to send the recording and a follow-up email as well. So we also have 2 more classes coming up. If you would like to join us, next week will be macro. We're going to go over community practice, supervision, research, group development, policy analysis, program development, everything macro. Indirect practice. That's what we're going to be going over next week, Tuesday at 7, so a little earlier. And then on the 24th, on the 24th will be just practice questions, all types of practice questions, so we can really go through and get a variety of practice questions to kind of end our time together and summarize and kind of go over everything. Whenever I do these types of study sessions, the questions seem so easy and or self-explanatory, but during testing is nothing like it. Yeah, some may be, but not most. My primary issue is how to answer the second and not second guess myself with complex questions. Yeah. And that might just be because we're explaining it, we're going over it. It's a low risk situation, right? When you're in the exam, it's high risk, right? You have anxiety. And so when you have anxiety, difficulty to concentrate also comes with that. And so trying to work on calming yourself and being able to remain calm will help you. So that's what I would say is that it does seem easy. And I would say also we have another 15, I don't know, I can't do math, whatever 22 minus 9 is. You have some more questions. So see how they go over with you in terms of how you do. But what I would say is that that's probably what's happening is that the anxiety, the second guessing, it's making it more difficult to answer questions. And those questions you've never seen before. So it is going to be more difficult, right? For sure. I have classes. So the next 2 weeks I have classes. I go on vacation in July, in August. So I probably won't have another series until maybe like November, unless it's just a lot of people have interest. I might do another one. But they're not as regular as they used to be just because when I have less frequently I get more people to sign up because it's been a while. I struggle with first next best. Yeah, it's my anxiety. You test again next month. You can do it. You can do it. I test again in the fall. Yes. Hardest thing to pass. Yep. Don't give up. My weakest subject on the test has been human development. Yeah. When are you doing this one? We did that one. I think it's been about 3 or 4 weeks since we did human development. But definitely follow me on Instagram because that's where I post all my classes coming up. Go ahead. I see a hand.
I had a question. So I had bought your bundle in 20 I took the exam in 2021 for my LSW and I passed. Has there been any changes to the bundle? Like, I mean, since you're not doing any more classes after the next two until maybe like October, November, do you think that there's a difference between the bundle from then and now? Or do you think I should still refer to that bundle because I still have it in my Google Drive?
Yeah, so 2020 was when I first started it. So I have made some changes since then. So just email me. I'm not gonna forget your name.
Okay.
So just email me. Yep, and
Okay.
just say, you want access to the new material and I'll send it to you. How much is the bundle? So the bundle right now is $99. Um, it's on a new platform. I have a new platform. It's $99. And I do have a cheaper price for those that have purchased it before and want the newer version. So that's why if you send me an email, I'll send you that discounted price. And for those that have an older version, like a Google Drive version, it's definitely different than the Google Drive because I have a practice exam on there. I have more questions, more videos on there. So yes, if you're interested in that, yes, please email me. Yes, please email me. TDC is great. Yep. It's effective for studying as well. Yep. TDC is great. I have a lot of clients that use TDC and then they'll come to my like study groups just to kind of reinforce how to break down the questions. But yeah, definitely is one of my recommendations for other study material is definitely TDC. Do you have info on the new test updates? I've heard things have changed since I last tested, which was when they changed it the first time to have less test options. So that's still something that they're working on. You'll see tonight that I had 4 answer options and I also had 3 answer options. Another thing that has changed is that you now take the exam in 2 parts. So you do the first 85 questions. They give you an optional break, a 10-minute break that's not included in your time. You have to fully submit the first 85 questions. You're not able to go back and change any answers. Like it's officially submitted, and then you'll start the second part of the 85 questions. So that's a newer change since April of this year. They're still trying to change it from 4 to 3. We're supposed to get a whole exam of just only 3 answer options, but it seems to be taking them a little longer because they keep switching platforms. So I don't think they've fully made that switch yet. The split sucks in my opinion. Yeah, it's not ideal for sure, but I wouldn't let that discourage you. I wouldn't let that discourage you too bad. And I felt rushed when I took the exam. Okay, that's good to know though. And what I would say is try to make it as best as possible. Especially if you're taking my full practice exam. I need to update it because I'm gonna make it into 285 so you can practice with it. Okay, 2026, they're supposed to be adding more ethic questions and changing the KSAs. Okay. They always trying to change something, it takes them so long. Okay. Well, ethics, we knew that's on there. So good. I took the clinical exam last year, missed by 9. Yeah. Agents of Change is definitely good. Yeah, and they do really good with updates because they have a whole she has a whole podcast and everything. Is the bundle replay on the new website that you use now? Yes, it's called Kajabi. That's the new one I use. It used to be Teachable, but now it's Kajabi. So I can definitely send that information. And I'm going to send all of the information about me, my classes, my products, and all of that in your follow-up, as long as with the recording from tonight. And I'll probably do that. It's Tuesday, so I'll probably do that by Thursday. And for those, my regular classmates, I will see you Tuesday. And if you would like to join us, do a drop-in rate as well. Oh yes. Oh yes. I want to do what's best for you. So if it's another program that's best for you, or if there's I'm not the only one. So yeah, absolutely. I want you to get what works for you. So um absolutely. Thank you so much for joining tonight. And I will see you all next week. 6 o'clock, 7 o'clock next week. Have a good night. Oh, you guys are so nice. So nice. Yes, please email me. And email me again if I forget to respond, okay? It's my brain sometimes. Have a great night. And don't forget to
Thanks.
study your 6 hours now. I'm not playing with y'all. 6 hours before next week. Okay.
Thank you.
You're
Bye-bye.
welcome. See you.
Thank you.
You're welcome.
Bye.